Hi everybody, welcome to Healthline. I am Gregory Zarian. Happy summer. Are you out in the sun? Are you playing? Are you going on hikes? Are you spending more time, hopefully, with family and friends? And you're off your phone, you've turned off the computer, you've DVR'd your favorite show so you can watch at the end of the day. As I say to you all the time, our mission here at Healthline is to have you be as healthy, as active, and as family-oriented as possible. You can obviously see something is on my shoulder. This is called a knapsack. It's a harness. We will talk about this at the end of the show. The conversation today is all about breast reconstruction after being diagnosed with breast cancer. October is Breast Cancer Month, and you know here at Healthline, we have our pink on and we talk all about signs, symptoms, what you need to do, what you need to know before, during, and after. So joining us from Adventist Health is Dr. Sepideh Saber, plastic surgeon specialist for breast reconstruction. How are you, doctor?
Very well, thank you. How are you?
Good to see you again.
Good to see you too.
Thank you for coming back.
It's a pleasure to be here.
I didn't scare you the first time then, did I?
Not enough, no.
Breast reconstruction after breast cancer surgery.
Yes.
It's a big deal.
Absolutely, yes.
Just because somebody, before that, you're diagnosed with breast cancer.
Mm-hmm.
Can we just really talk quickly about what breast cancer is, the diagnosis, and then when you become eligible for reconstruction and plastic surgery?
Of course.
What is breast cancer?
Breast cancer and cancer in general is usually a cell in the body that runs amok. Okay. And the way it does that is by multiplying over and over again. It doesn't stop multiplying. And it will eventually become large enough to form a mass. And it is basically one of your own cells that has mutated and has changed.
It's basically your body fighting against yourself.
Exactly.
As you say, the mass then turns into breast cancer stages 1, 2, 3, 4.
Correct.
So the smaller the mass, the better the stage.
Yes, it also has there's different types of cancer.
Of course.
Some are less aggressive, some are more aggressive.
But bottom line, though, is for women, because when we hear about breast cancer, we think more of women. Mm-hmm. But out of every 100 new diagnoses, 1 to 3 are men. Correct. First and foremost, we should self-exam.
Absolutely, yes.
Okay, so I'm going to ask you the proper way on how to self-exam when we come back. Between now and on the other side, stand up, take a stretch, get some water, and more with Dr. Saber when we come back. Don't go away. Welcome back to Healthline. I am still Gregory Zarian. Hope you had a great stretch. Hope you had 2 glasses of water. The conversation is all about breast reconstruction after breast cancer. And bottom line, the diagnosis of breast cancer is scary in itself. But then the conversation of breast cancer reconstruction is even scarier for all women. Joining us from Adventist Health Glendale is Dr. Sepideh Saber, plastic surgeon specialist to breast cancer reconstruction. Doctor, before we left, I talked a little bit about self-exam and how important that is, and we'll also address mammograms. Give us some of your medical history first.
Sure. I did my medical school at Stanford University, and then I followed that up with a plastic and reconstructive surgery residency at USC LAC Medical Center here in LA. I did an additional subspecialty in hand and microsurgery as well.
What got you into breast reconstruction?
Well, breast reconstruction is an integral part of plastic and reconstructive surgery. And
when you say plastic, we're talking just about plastic surgery.
Plastic surgery, you know, on TV and in the general public, people think that cosmetic surgery is plastic surgery, and it is a part of plastic surgery. But really, I would say more than 90% of plastic surgery and its training focuses on reconstructing body parts. And the breast is a very important part of that. And so, you know, when we say reconstructing, we mean returning back to normal form, normal aesthetics, and normal function, if possible.
Well, I love that you said normal aesthetics, because breasts are very visual
Yes.
for the female,
Yes.
but also for who their partner is, who they are in society. So I
Yes.
love that your mission is to give women back their self-confidence. Because within one diagnosis, you lose what you have known for so long.
Yes, it's
And
it's
just
a part
that
of you.
is debilitating.
It is.
Not so much physically, but emotionally.
Correct.
We'll dive into that. Before the break, I quickly touched on self-exam. Can you share with us really quickly just the right way to self-exam?
Sure.
And this is for men and women.
For men and women. The best way to do that is, in your daily shower, what you can do is use your dominant hand and gently, just with light touch, go over the breast tissue in light circular motion. And then you can follow that up with a little bit of a deeper pressure palpation in order to really feel the entire breast gland and see if there's any abnormality. And if you do that regularly, you will feel changes and you will know what is normal and what is new.
And when you say, the breast, so basically from here all the way down and even underneath the armpit.
Yes, so the breast starts, at the breastbone, the collarbone.
Okay.
There's breast tissue all the way up there, down to the breast fold, and then it goes through to the midline of the body, and laterally, or on the side of the body, you want to go all the way to the axillary line, and including your axilla as well.
We've talked a lot about this at Healthline. Check yourself in the shower. And also what I heard here too is sometimes lay down, because then your breast or your pec for men is flat, and you can actually see something or feel something that's different.
Yes.
And also to look for is the nipple looking different and a discharge.
Yes, so you can have abnormalities of the skin. You can have dimpling.
Okay.
Especially if the mass is a little bit deeper, and you may not feel it, but if you see dimpling of the skin, that may be a sign to go have yourself checked out. Discharge from the breast, it can be clear, it can be bloody. All of that is concerning, and at least should warrant a trip to your doctor. Yes.
And one thing too is don't Google and self-diagnose. And one thing as well too that we talk about often is if you are in a relationship, talk to your partner about it. And what I invite everyone to do is if you have a partner, a significant other, husband, wife, really look at each other. Like if you are taking off your top and shirt, like have your partner look at your front and your back and your body, because they see things that we can't see.
That's
and if there's something that shows up differently, make a phone call and go, hey, what do you think? Point it out to your partner so you do it collectively. And you're just proactive in regards to your health.
Absolutely, yes.
So everyone self-exam, period. Promise, great. And then also get a mammogram. And we were talking before the show that if a mammogram comes back with a different shadowing, imaging, inconsistency, they'll send you in for another one.
Correct, yes. Sometimes, mammograms can be not perfectly clear. Younger women can have very dense breast tissue and maybe followed up by a more, by a different type of mammogram or an ultrasound or even an MRI to be very specific. If there's anything that is quote unquote suspicious, it doesn't necessarily mean that it is cancer. And sometimes women are sent for biopsies just to be safe. Biopsies oftentimes come back negative, meaning it is a benign mass or a cyst. But it is mandatory to do this. It is really important to do this because it can catch cancers, and it can catch them early on to where you can actually save the breast, and have minimal procedures to become cancer-free.
Bottom line, save your life.
Yes.
More with Dr. Saber when we come back. Don't go away. Welcome back to Healthline. The conversation is all about breast reconstruction after a breast cancer diagnosis. Joining us from Adventist Health is Dr. Sepideh Saber, and her specialty is plastics and plastic surgery and reconstruction of the breast after you have been, or someone you love has been diagnosed with breast cancer. And what I love that you said, doctor, is, and we discussed, it's just about giving a woman kind of her life back.
Yes.
A woman is diagnosed with breast cancer.
Mm-hmm.
She has a mass.
Mm-hmm.
The conversation is whether or not, what to do with the mass. Do you keep the breast? Do you opt for a mastectomy, double mastectomy?
Mm-hmm.
You know, some of the research that I did earlier was, 85% of all breast cancers now are just, as you said, environmental. It's not even about hereditary. And also, ladies and men, check your family history for the BRCA gene, breast cancer history in your family. The more you know, the more you can give to your doctor, and the more they can do.
Correct, yes.
Who decides that a mastectomy happens?
So breast cancer care is really a comprehensive care. And when you look for a center of excellence, a cancer center, you are looking to go to a place where you have a breast cancer surgeon, hopefully a breast reconstructive surgeon, a radiation oncologist, medical oncologist, a whole team, social work. So who decides that a woman will have a mastectomy? The decision is often done by the breast cancer surgeon and the woman together.
I also love that you created the team, and everything
Yes.
that you said is available at Adventist Health Glendale.
Absolutely. So at Adventist Health Glendale,
Accredited Cancer Center.
we have all the different specialists, and we work as a team to take care of the woman's need as a whole. And we're not just looking at the cancer and at the breast, but at the whole person's care. And sometimes that involves other medical problems that the woman may have, emotional problems, psychological, social work issues. So all of that needs to be taken into account to make the patient recover and do well.
So do you suggest, and you're there with the doctors,
Mm-hmm.
do you as a team suggest the mastectomy, or is it more personal for the patient?
Normally, the woman and her breast cancer surgeon will
team.
come to that decision. So by breast cancer surgeon, I mean the surgical oncologist. So myself, I'm a breast reconstructive surgeon, a plastic surgeon, and I normally wouldn't make that decision with the patient.
But they would talk to you about it?
But they would talk to me about it. They definitely will
Right.
ask my opinion. Oftentimes I will refer back to the breast cancer surgeon because the number one goal is to treat the cancer, to get rid of the cancer, and then the number two goal is to restore form, restore the breast.
Because you can't do the plastic surgery if there's still cancer in the breast, can you?
No, I cannot. Absolutely. First, we need to rid the cancer and get rid of the danger, and then we can go ahead and reconstruct
rebuild the
Yes.
life. So someone has a double mastectomy.
Mm-hmm.
They have been deemed cancer-free.
Mm-hmm.
They are then given the go-ahead to be with you. What happens? How do you then, what goes into rebuilding the breast on someone that has opted for a mastectomy?
That's a very good question. Sometimes I will meet the patients before they even had their mastectomies. And that's what we talk about when we say a comprehensive care. Breast reconstruction is now no longer considered a privilege. It is part of an integral component of breast cancer
Don't
care.
you love that, though?
Absolutely. It is important. And it gives patients hope. Of course, we are all on the same page. We want to get rid of the cancer. We want to treat the disease. But we're not losing track, or we're not forgetting the reconstructive part of the cancer care either. So, I can oftentimes coordinate with a cancer surgeon, and some women will have the first part of their reconstruction done at the time of the mastectomy.
Oh, that's fantastic.
So that could be an immediate breast reconstruction at the time of mastectomy, versus, you know, some women will decide to first go ahead and have their mastectomy, complete the cancer treatment, or may not even be healthy enough to start the reconstructive part right away, and will first complete the cancer treatment and then come back for a delayed reconstruction.
So then somebody comes in and says, let's do this.
Mm-hmm.
What do you do?
I will talk to them about the different types of cancer, of breast reconstruction.
What are the different types?
The different types are either implant-based reconstruction or using your own tissues,
Which
autologous
that's called the
tissue.
tram flap, right?
A tram flap is one of the ways that you
Okay.
can use your own tissues to reconstruct a breast.
Because as I said to you before we started filming, one of my dearest friends, she had the tram flap procedure.
Yes. And the tram flap stands for transverse rectus abdominis myocutaneous flap, which is why we call it a tram flap. But basically it is using your abdominal skin and fat and a part of your rectus abdominis muscle to take that, you know, similar to a tummy tuck, but a little bit more invasive, because it will use part of the muscle and it will use the blood supply that comes with it. And then bring it up to the chest and hook it up to blood vessels in your chest under the microscope. It is a big surgery. It is a transplant surgery from yourself to yourself. And that is the tram flap. There is a more advanced version of the tram flap. It is called the DIEP flap, which is the deep inferior epigastrous perforator flap. And that flap will not use your muscle. It will tease out the blood vessel from within the muscle, or as it goes through the muscle, and thereby save that muscle. And it can be done in many cases. In some cases it can't.
But bottom line though, it's basically repurposing your own body.
Yes.
More with Dr. Saber when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarin. Okay, did you know that there's a party? A party is happening and you don't want to miss it. The party is where you can bring your friends, family, kids, pets, dogs, cats, grandma, grandpa, anyone you care about and love to Glendale Central Park, August 24th from 10 a.m. to 1 p.m. for Glendale's first Wellbeing Block Party. And it's hosted by Adventist Health and the American Heart Association and American Stroke Association. Discover fun and exciting ways to exercise with your friends and your family, and that doesn't mean having your phone out. And you can also bring home fruits and vegetables from the free produce market. It's all about getting your health on. There'll also be a fun kid zone for the little ones who will be entertained. It's free. Let me say it again. It's free and it's open to the public. So please don't forget, Saturday, August 24th from 10 a.m. to 1 p.m., Glendale Central Park. See you there. Leave your phone. Well, actually, don't leave your phone in the car, because you can take photos of all of us and then also get some great information that you can pass on to your friends and your family and teach them how to be healthy. Are we good? Great. Bring water and wear sunscreen. So the entire conversation today has been all about breast cancer, self-exam, and what happens after you are diagnosed with breast cancer and you have opted to have breast reconstruction. Joining us from Adventist Health is Dr. Sepideh Saber. You have been so open about what all this is. Mm-hmm. And what I love is sometimes you see a doctor and we're all afraid. You know, with this that I'll talk about in a few minutes, of course I'm afraid. Like, do I have to have surgery? Don't I have surgery? What is it? What isn't it? And the way you're delivering the information, thank you, because I know your mission is to have all of us be as healthy as we can be and also not be afraid.
Of course.
You know, when you get the diagnosis, when I was talking to my friend earlier who opted to have a double mastectomy, she had the tram flap. She said after her breast cancer diagnosis that there was the possibility, 20% of the breast cancer coming back. Mm-hmm. So she made that choice. Do you find that most women in today's day and age make these choices?
It's hard to generalize because breast cancer treatment is such a personal treatment and every woman is different. There are women who will opt for just removing the cancer if that's possible,
Okay.
and that's called a lumpectomy. Some women will not be, a lumpectomy may not be an option for them because of the size of the tumor or other factors, and in that case they will undergo a unilateral mastectomy, meaning a mastectomy only on the affected side, on the cancer side.
But then if a woman is diagnosed with that, do they then see you for plastics?
They do see me
Okay.
for plastics. A lot of women will come to me and say, should I remove my other breast? Should I do it for symmetry of the reconstruction? And I always tell them, removing your other breast for symmetry of reconstruction to make both sides, reconstruct them at the same time is never a good idea. But removing the other breast should be, again, discussed with your breast cancer surgeon. And, there are certain factors for that. If there's a high family risk of breast cancer, and there's a high lifetime risk of personal breast cancer. If you carry a breast cancer gene, the BRCA gene, BRCA1 or BRCA2, or if you just have an overwhelming fear of developing breast cancer and you don't want to undergo yearly mammograms, that would be a reasonable reason to go ahead with a double mastectomy.
A woman opts for a double mastectomy. She sees a plastics doctor.
Mm-hmm.
She has the procedure done.
Mm-hmm.
We were talking earlier about the repurposing of the body.
Right.
The tram flaps surgery, and then the one that you shared.
The DIEP.
What about implant?
So most women will actually opt for the implant surgery.
Because
it is a shorter surgery,
Okay.
faster recovery time. An implant.
What are we looking recovery time for the earlier procedures that we just talked about?
Those are large surgeries. Those
Okay.
are, you could compare them to a not really. I mean, but it is a transplant surgery from your own body to your own body. You would be in the hospital for approximately 5 days.
Okay.
You do have new scars on your body, so wherever we take the tissue from, whether it may be the belly or the buttock or the thigh or the back, there will be a new scar.
Okay.
You will have to heal those scars, heal those wounds, and it is in general a longer surgical procedure. Now with an implant comes out of the box. You don't have new scars on your body. There's disadvantages and advantages to any type of procedure, but an implant can be placed, and a lot of times the recovery period is, the woman can go home, the next day or even the same day if it's a delayed procedure.
Isn't that where the women then wear binders? Is that what that's called?
Usually a surgical bra, which is a special bra that doesn't have underwires, doesn't put too much pressure on the breast.
But isn't there something after breast cancer surgery, something called a binder or something like that? What is the name of the?
There are binders that can be sometimes placed more in the cosmetic world when the implant is high initially, and it can be placed to assist the implant in dropping, which it will over time.
What is the recovery from implant surgery?
The recovery from implant surgery is, it does not add much to the recovery from the mastectomy.
Okay. How much physical therapy is required for both procedures?
Again, very individual. It depends on the woman's activity status before surgery. Physical therapy will focus on not allowing your shoulders and your chest to get stiff. It will focus on moving your shoulders, moving your arm above your head. If you're opting for the tissue transplant surgery, it will focus on getting your core strength back without lifting heavy things that may cause you to potentially develop a hernia early in the recovery period. If you lift heavy things and you have a big scar from where we took the tissue from.
I have to wrap out quickly, doctor, and then also in regards to nipple placement, that then turns into a conversation with you, the plastic surgeon.
Yes.
Doctor, final thoughts in regards to breast cancer survivors and breast reconstruction surgery.
Breast reconstruction, again, is an integral component of breast cancer care. The breast is not a vital organ. It is not necessary for life. You don't have to have a reconstruction if you choose not to, but a woman should definitely be told that she has the right to, in most cases, to have a breast reconstruction performed, and that talk should be initiated at the time of breast cancer diagnosis and along with the breast cancer care.
Doctor, thank you so much, because one thing I want to throw out there too is if a woman opts to have a double mastectomy,
Mm-hmm.
it doesn't mean that they have to lose who they are. And at Adventist Health Glendale, there is a cancer team before, during, and after that will help them be the best they can be after a breast cancer diagnosis.
Correct.
Thank you
yes.
so much.
Thank
Will
you
you come
very
back
much.
again? Did I scare you, or we're good?
Not at all.
Oh, yay! Okay, so here's the thing. 85% of all breast cancer diagnosis, it's environmental. Ask questions. Don't self-exam. Don't self-diagnose. Talk to your doctor. Talk to your partner. A cancer diagnosis, it's not about just the patient. It's about your friends and family. Our mission here at Healthline is to make you as healthy as you possibly can be and give you all the information you need to know. You can always find us on social media. You can find us on Facebook at AH Glendale, LinkedIn, Adventist Health, and also you can always find us on the website at AdventistHealthGlendale.org, and you can find me at Gregory Zarian. So I am in a knapsack, a shoulder harness. Here's what happened. Somebody was texting and driving a year and a half ago. They decided to not pay attention and totaled their car into the back of my truck. And what they did is they hit me so hard, they knocked my bicep tendon out of the groove onto my shoulder, causing me a year and a half of pain and now surgery. When you're driving, put your phone down. Pay attention. People die and get hit every day from texting and not paying attention. This is an example of it. If one thing we can share with you today is just pay attention. Our mission here is to have you be here for a very long time. We'll see you next time. Thank you for joining us. The most important conversation you're going to have is about you and your health, so why not have one now?